I'm Alan Davis, a software engineer, a former cardiac nurse, and a senior lecturer in Health Data Sciences at the University of Manchester. My goal on this channel is to make health data science, AI, and digital health understandable for clinicians, researchers, and anyone else who's interested in learning about this technology. So if you're working in healthcare and you're thinking about changing your career or just getting more involved with things like digital health and digital transformation, you might be wondering exactly what to do. There's a whole lot of different directions that you could go in here, and this includes roles like data scientists, data engineer, informatics, data analysts, and digital health. So through my academic role, I've been involved in various projects focusing on workforce development and skills, competencies, capabilities, etc. This includes things like the core competency framework for the then Faculty of Clinical Informatics, the AI and Digital Healthcare Technologies framework for the NHS, and more recently work around the UK CERSI Centres of Excellence for Regulatory Science and Innovation on in silico technologies. So this research, along with my teaching activities on courses like health and clinical data science and health informatics, has given me some understanding of the overlaps and the differences between some of these roles and what they involve. So for the rest of this video, I'm going to dive into some of these roles in a bit more detail, discuss what's involved, and what the skills and interests the particular roles might suit. These roles all work with health data, but they differ in their primary objectives, their methods, their technical focus, and there's often considerable overlap in some of the roles, particularly in healthcare organisations and research settings. So health and clinical data scientists work really around extracting knowledge and making predictions from health data using things like machine learning, statistical modelling, artificial intelligence, predictive and analytics and clinical research, causal inference. And they often use things like programming tools, so things like Python, R, to help them, and visualizations. A clinical or health data engineer, on the other hand, is focusing on things like building the infrastructure for the data. So designing things like databases, extract, transform, load pipelines, data integration, cloud platforms, interoperability, things like SQL, cloud computing, FHIR, HL7, database design, and so on. Health and clinical informatics is really around improving healthcare through effective use of information and digital systems, things like electronic and clinical health records, workflows, information governance, clinical knowledge, and various system standards, change management, and so forth. Analysts, on the other hand, tend to use existing data to answer operational or research questions. They use things like reporting dashboards, descriptive statistics, key performance indicator monitoring, audits, SQL, Excel, Power BI, Tableau, and so forth. Whereas digital health practitioners, on the other hand, tend to deliver or support healthcare using digital technologies. So using tools like remote monitoring, telehealth, digital therapeutics, digital literacy and transformation, patient engagement, and digital systems. So I just want to delve, I've thrown a lot of different words and terms out there, so I just want to go back through that in a little bit more detail, just to separate out what these kind of roles do in a bit more detail. So high level overview, and then zoom in a little bit on, some of the specifics. So if we go back to the health and clinical data scientist, for example, so you might have heard in the literature, sometimes we talk about type A and type B data scientists. So the type A is more like a statistician, so building analytic scripts to do statistical analysis on data sets, whereas type B is a little bit more like a software engineer, and they'll use data in digital products and services. So it's more around getting the data into an active system or service. So typically data scientists will go heavily into things to do with data, quite a narrow discipline in some ways. It's very focused in on the data, specifically the analytical techniques, and it goes a bit further than data analytics, which often deals with sort of routinely collected data, and it can do things like model development. It can touch more on things like research. It can involve things like machine learning as well, and typically data scientists tend to be people that can also code and have some knowledge and awareness of things like statistics. So sometimes this is someone coming into it from a statistical background, maybe they're a statistician, and then they're learning more of the computer science side, scaling things with things like machine learning techniques and learning to code, to do things at bigger scale, deal with big data, that sort of thing. Or it could be the other way around. It could be someone who's more of a computer scientist, more of a programmer, that kind of background, learning more about statistical techniques and processes. So there can be a bit of a mixture in that sense. They often combine data sets in structured and unstructured formats. So it might be combining data from, say, wearable app data with a database with other kinds of data. So there's often work there around kind of cleaning and preparing the data. Sometimes in larger organizations, a data engineer will do some of this work, some of the data cleaning and data preparation and data quality work. In smaller organizations, this can be part of the data scientist's role as well. Also, with a specific data engineering role, that can also lean more into the infrastructure design, so things to do with databases and how the data is stored and managed. So you might have heard of things like data warehouses, data lakes, that sort of thing. So what's that infrastructure looking like? Is that infrastructure managed locally, or is it on the cloud somewhere? So it's often managing that. So large amounts of data. There might be data used in production, data used in research, archive data, and so on. So that tends to be more on the infrastructure side and delivering data as a product to other teams that may use that data, including data scientists and data analysts. So health informatics, in contrast to that, is quite wide a discipline. So I talked about data science being quite narrow. I say informatics is kind of quite wide because it looks at lots of different things. So it can have elements of data analytics in it, although that's not the main focus of informatics. It tends to use information science, computer science, and healthcare knowledge to improve the collection, management, and use of health information applied to patient care. So this can include things like procuring systems, so things like electronic patient records, health records, and integrating those into a system like a hospital trust, for example. So managing that, the change management side of things as well. So mapping those existing business practices and structures, and then how do we insert that new service and evaluate it. So can be a lot wider in that sense. So health informatics tends to focus more on people, processes, and information rather than algorithms and data like the data scientists and data analysts do. So it can include things like clinical workflows, clinical coding. So you might have heard of things like SNOMED, CT, things like that. How do we represent clinical diseases and procedures using interoperable codes, information governance and decision support systems. And then, as I said, change management and interoperability. So making sure systems can talk to one another. The health or clinical data analysts, they might be involved in things like collecting, analysing, cleaning, visualising healthcare data to answer usually operational, clinical or research questions. So compared with data scientists, analysts typically focus on descriptive and diagnostic analysis rather than doing things like building predictive models. But as I said, there is overlap in many of these things, and you might find in some places people are doing all sorts of different overlapping things. So typically this would include things like KPI reporting, dashboards, things like waiting list analysis, that sort of thing, service evaluations and audits, trends, answering particular questions that they're, what happened and why, that sort of thing. And then finally, we've got this notion of a digital health practitioner. So this is much more close to the kind of the front line than some of the others we've looked at. So essentially, it's usually a healthcare practitioner of some kind that's using digital technologies with patients to deliver support or improve patient care and or services. So unlike the other roles, it's primarily a clinical practice role rather than a data-centric or technical role. So work might include things like using things like telemedicine, remote monitoring, digital therapeutics, patient-facing apps, wearables, things like virtual wards, digital transformation, and that sort of thing. So essentially, how can digital technology be used to improve patient care? So the different roles that I've discussed are quite complementary. They often work together and there's often overlap. So for example, in developing a hospital readmission prediction model, a data engineer might build the pipelines to extract and integrate the electronic health record data. The analyst might explore the data and produce descriptive statistics and look for trends. The data scientist might develop and validate a predictive model. And the health informatics professional might ensure the model integrates into clinical workflows and aligns with things like information governance and supports safe use. And then the digital health practitioner uses the resulting tool in practice, interpreting the outputs alongside using their clinical judgment, and helps to evaluate its impact on patient care and service delivery. So the key distinction really is that data scientists tend to generate new knowledge from data. Data engineers allow access to high quality data. Informatics professionals optimize how data is managed and used. Data analysts explain and report on the data, and digital health practitioners apply digital technologies directly within healthcare delivery. So if we had a spectrum on one end of purely technical and the other end purely clinical roles, I would say as a sort of ballpark that things like data engineering, data scientists are more strongly on that technical side, whereas things like informatics and digital health are more on the delivery side, if you like. So probably informatics sits more in the middle, if you like, than some of these other roles. So if you like the idea of, as if you're clinically focused at the moment, I guess this is where you have to ask yourself a question. Do you enjoy being clinical? Do you like what that brings with it? Do you want to stay clinical, or do you want to retrain into something to take you away from that clinical side of things? So if you wanted to use repurpose your clinical knowledge and leave the clinical environment completely, then looking at things like retraining into being a data scientist or a data engineer using that clinical domain knowledge would be something to consider. If on the other hand you still want that clinical connection and interaction, then things like digital health practitioner and informatician would probably be more aligned with that, because it would give you the opportunity not just to work with the technology but to work with it in healthcare practice, and not being in a room with a computer, but doing some of that, but then also seeing and delivering that technology actually to patients. So using your clinical knowledge and expertise and domain knowledge with the technology directly. So I guess this is the question that you would have to ask yourself if you were thinking about retraining into some of this stuff, is how strongly do you want it to complement your existing clinical knowledge and clinical duties versus going down a different route entirely. So I'd say in summary, if you want to retain a clinical presence, then informatics and digital health are probably more appropriate. And they can be particularly rewarding, as I said, if you like to see the end result of these digital interventions on healthcare delivery and combine your clinical and digital skills practically in an individual health providing situation. So I also personally believe that anyone can learn anything provided they're interested in the subject and they put the time in. So the more technical roles on the spectrum require the development of things like skills like coding. So I think with something like that, motivation's quite important. And this is a generalization, but I found that when people have incentives other than deep interest, so maybe financial remuneration, they can find it harder, not impossible, but harder to develop those skills. So you think of it like playing a musical instrument, like the guitar. You need to be motivated to keep picking up and playing that guitar till you get good at it. And it's obviously easier if you've got a genuine interest in music and learning to play. So I guess what I'm saying is that your goal has to be strong enough to sustain you throughout that learning process, so you don't lose interest, or worse, start to resent the process. So it might help as well, if you can, to shadow somebody for a day or a week or longer to see what the job actually looks like. So if you're really thinking about changing role or adding to your role, above the glamour and what you've seen on, maybe YouTube videos and what people have told you, what does it actually look like? What are the actual roles and jobs? What does the 9 to 5 day job for these people look like, beyond the glamour? And can you see yourself doing this day in and day out? Is it worth it to you, and can it sustain your interest in order to learn it? Because, as I said, with the technical domains, they're fast moving as well, so it's not like you can learn these skills once and then just keep doing it. You need to keep on learning, because as with medicine, where there's new drugs, new treatments, new procedures, the same in the technical topics. There's new algorithms, there's new techniques, new programming languages, all sorts of things. So you have to constantly you have to be interested enough to maintain that interest and keep wanting to learn. Another thing I'd say is sometimes people get too caught up in learning tools and technologies, and of course it partly is about that. You need to know how to use some of these tools, but in my mind it's really about developing that problem-solving mindset. So you might have heard the phrase, if all you have is a hammer, then everything looks like a nail, or something like this. So if you develop a deeper understanding of the problems, you can pick the right tool for the job. So to give you a personal example, I often use both Python and R for data science tasks. And I often find that in one situation, one of them is better or more preferable than the other. And I wouldn't hesitate to learn yet another language or tool if it offered something preferable to solve a particular problem as well. So I advocate learning things like transferable concepts. So don't just learn Python, for example, learn to program, learn database concepts rather than sticking to specific tools which can be replaced or come in and out of fashion or be superseded. So yeah, I think if you can understand some of those concepts, like you understand the fundamentals of programming, for example, then you can apply that to different programming languages, even future programming languages. The same with databases. If you understand the concepts of relational databases or NoSQL databases or graph databases or vector databases, then you can apply that to specific examples of those types of database, for example. So if you are interested in learning to code, I've actually written some books on the topic, on learning to code and mathematics as well, for clinical and health data sciences. So these are really written for people that are coming from a non-engineering and maths background, computer science background. They're for people coming from a health and social care background that haven't got that sort of formal mathematics and computing training that people that maybe come from that engineering sort of disciplines have. So it doesn't assume any prior knowledge and sort of starts with the fundamentals essentially. And the examples are in both Python and R, so you can pick which one of the two most popular languages for data science that you'd like to use. And if that's of interest to you, you can find links in the description below. Also, if you prefer something online, then I've got a free online short course in learning to code for people coming from healthcare background, also linked in the description. At the moment, this is just available in Python, but an R version is coming soon. In future videos, I'll discuss these roles in a bit more detail, as well as take a bit of a deeper dive into some of the technologies used and actually look at some examples of how we can apply some of these tools in practice.